slip capital femoral epiphysis is also called SUFE or SCIFE, and it usually occurs in teenagers where they develop a fracture through the growth plate of the proximal femur in the hip. They usually present with pain either in the hip or the knee, and often the leg is externally rotated as they walk. This can happen very acutely as in a normal fracture, but it can also happen very slowly with time. So sometimes it can be missed, and patients will sometimes come and see pediatric orthopedic surgeons like myself after weeks or months have passed by. If that's the case, not to worry, there are still treatment options available, and once we get the right imaging and make a diagnosis, then there are a variety of treatment options available. SUFE is usually diagnosed with plain X-rays initially, but sometimes we need to do MRI scans or CT scans if there are other things going on that need to be evaluated. And these tests usually can be done, at least the X-rays, on the day of the initial consultation, but sometimes the other tests need to be booked and are done at a later stage. So the most common treatment option for SUFE is in situ pinning, where the patient is taken to theatre, given a general anaesthetic, and a single screw is placed across the slip to stabilize the femoral head. And usually this is enough for treatment, and the patients usually do very well. Sometimes we need to do the other side as well, because this side is at risk of slipping, and this will be discussed with you at the consultation. In addition, in more severe cases, sometimes further surgery is needed, but this will be discussed with you at the time of the consultation. And in addition to this, sometimes if it's a very acute case, then a small incision can be made at the front of the hip joint to try and partially reduce the slip before fixing it with the screw. So there are a couple of things that can happen in a patient with SUFE. They can develop a vascular necrosis of the femoral head, which is probably the most common complication that we see in those SUFEs which are unstable or where the pain is severe enough that the patient can't weight bear on the leg. If this happens, what happens is the blood supply is damaged to the femoral head, and so a part of the femoral head will die. And so this is really something that needs to be monitored very closely, because the treatment is very difficult for the situation. Sometimes, in addition to this, there may be damage to the labrum or the front of the hip, to the soft tissues surrounding the hip joint, if there's a slip that's been ongoing for some time, and this can cause early arthritis of the hip, which may need to be dealt with later by one of my adult hip colleagues. In addition, sometimes if a patient comes in with a very severe slip, then discussion needs to be had about whether an open reduction is indicated here, or sometimes what we'll also do is we'll fix it in situ, and then at a later stage we'll do an osteotomy just below the neck of the femur to correct the biomechanics of the hip joint. But these are all very complicated things that can be done, and each case is very different, and so we really need to assess each case on a case-by-case scenario to decide what's best for the patient.